Good morning, HHS. Thank you so much for coming today. It is such an honor to have the Vice President here today to address HHS employees and honor the good work that you do every day. As many of you know, the Vice President and I go way back. When the Vice President was Governor of Indiana, I helped advise his team on Medicaid and other health issues. And let me tell you, this man became an expert on any healthcare issue that we brought to him. And more impressive, and what I saw in this man was his commitment to the needs of the most vulnerable in our society. And one of the things that he always said that stayed with me was that a society is judged in how they care for the most needy in our society. And that's something that's always stayed with me, and it tells me about what's in this man's heart. In Indiana and other states where I worked, we felt strongly that governors and state legislators needed flexibility to come up with plans that work best for their unique situations. And when states have gotten that flexibility, the results have been impressive. The freedom to innovate and in Medicaid, however, has been hard to come by. We've also seen impressive results when states are permitted the flexibility to innovate in the delivery of human services, like under TANF. The expertise this department brings to bear is unbelievably impressive, but I think we can all agree that Washington does not always know best. State innovation is key to providing high quality of healthcare and human services. One of President Trump's key priorities for healthcare is empowering states to innovate and restore balance to the federal-state partnership. The same dynamic applies when it comes to how our federal healthcare programs, Medicare especially, sometimes takes a one-size-fits-all approach to issues. Patients and physicians are better off deciding for themselves. To get to a patient-centered, sustainable healthcare system, we have to find a better balance than what we've had in the past. And someone who understands the importance of listening to doctors and to states so well is our boss, Dr. Tom Price, whose career in public service and medicine has set him up perfectly for the role that he has today. So let's have a round of applause for the 23rd Secretary of the Health and Human Services, Dr. Tom Price.
Thank you. Thanks, Seema, so very much for that kind introduction, and thanks for all of the work that you do and your whole team over at CMS. You do a great job, and we're thankful every single day that you're here. Good morning. What a treat this is, I tell you, to be able to have the honor of the Vice President coming today to bring greetings from the President of the United States. Now, I'm told that it's been a number of years since either a President or a Vice President came and visited us here at the Humphrey Building and to give word and voice and honor for the work that all of you do. So, Mr. Vice President, I want to thank you for coming here today. We've got some great folks out here who are doing incredible work on behalf of the administration. This team here and those that you all that you represent do incredible work each and every day, whether it's supporting folks from in all states across this nation on the human services side, or doing the remarkable cutting-edge research that's done at NIH, or the work that's done at CDC or SAMHSA, or all of the staff divisions that we have here within HHS. You all do incredible work. And that impact, as you all well know, goes beyond the borders of the United States. As some of you know, we took a trip to Liberia recently, and I was so incredibly impressed with the brave men and women of the Public Health Service Corps, CDC, HRSA, NIH, all of the men and women who are on the front lines, who helped our local partners beat back Ebola in West Africa. And I can't tell you how moving it was for me on behalf of you to meet some of the Ebola survivors in Liberia. These are individuals who are alive today in no small part due to American generosity and ingenuity and passion and caring. So I just want to give you and all of us an opportunity to give a huge round of applause to the HHS team and the work that we're doing around the world. But as you know, the story doesn't end there. We are now helping to build up local government capacity in West Africa and literally around the world so that folks won't face that kind of crisis again. So it's with great pride and cognizant of this department's wonderful and remarkable achievements that we welcome the Vice President here today. I'm lucky enough to have known the Vice President for a number of years, over 15 years now. Had the privilege of serving with him in the United States Congress. We worked on budget activities and health care activities, and he is now taking the lead, working with Congress to execute the President's health care priorities, which he'll share with you in just a moment. Also had the privilege of traveling with the Vice President to Wisconsin and Ohio earlier this year, and we met with small business folks, and they shared their concerns that they had. I can tell you that this is an individual, the Vice President is an individual who has a unique ability to connect with folks where they are, to understand and appreciate the concerns that they have. And they were voicing their concerns about their businesses and about the healthcare system. And healthcare is such a focus for President Trump because the situation right now in many, many areas, as you know, is simply unacceptable. You all know the challenges that many Americans face generally because you work on these issues every single day. Getting us to a health care system where every American is able to afford and gain quality health care and health coverage is not an easy task. You know that. But getting us there is a goal that each and every one of us share. One of the toughest challenges we have right now, as you know, is in the individual and small group market. We've seen rapidly rising premiums and deductibles that are going up, making it much more difficult for the millions of Americans out there to gain the kind of coverage that they want for themselves and for their families. Even with the higher prices, we get word every single day, virtually, that insurers are either leaving the market or the exchanges or threatening to do so. So fixing this situation, as the saying goes, requires an act of Congress. And the President understands and appreciates that. But there's much more that we can do right here at HHS, and with the President and the Vice President's support and leadership, we can do a lot to improve the situation currently. And I want to highlight a couple of those things that President Trump and HHS have done just in the past few months. The actions that we've taken, as you all well know, fall into three basic categories or buckets. Stabilizing insurance markets and increasing choices for patients, opening up new options for enrolling in insurance, and encouraging state innovation. And all of these are done with a focus on trying to get to a patient-centered healthcare system. One of the very first regulatory actions that we took under this administration was a rule that has now been finalized, which covers a whole range of issues, with the main goal of that rule to help stabilize insurance markets, trying to put downward pressure on the premium increases that folks have seen. So we tried to bring clarity to the special enrollment periods, to the grace periods in enrollment, and tried to give states greater opportunity to define what constituted a qualified health plan. These new rules encourage people to stay enrolled with insurance the entire year, so that helps result in a healthier risk pool. And within the same regulation, we also loosened the rules a bit to give folks an opportunity to have expanded plans and coverage plans options for them. In addition, we also tried to make enrollment simpler. Many of you know about the shop exchanges, the small business exchanges that are out there. What we saw, however, was a remarkable decrease or minimal uptake for the shop exchanges. So what we've tried to do is to begin simplifying the processes so that individuals are able to get their coverage through either a marketplace or through a broker on the shop exchange. We also responded to feedback from individual consumers who said that healthcare.gov was a greater challenge than they had desired for them, and so we've tried to provide an alternative online tool. And then the last major goal that we pursued was trying to encourage state innovation. Much of our healthcare system, as you know, depends on a functioning, working collaboration, a partnership between the federal and state government. A lot of these partnerships, however, especially in the area of Medicaid, haven't been working as true partnerships. And we learned that from talking with state officials, yes, and with governors, but folks who are in the system itself have appreciated that it hasn't been working as smoothly as it should. So President Trump, Vice President Pence, and this administration are absolutely committed to fixing that. The Affordable Care Act took a lot of power away from the states in both their role as insurance regulators and in terms of how they run their Medicaid programs. So protecting patients across our lands means resetting those federal-state partnerships and paving the way for states to innovate. So we've made a firm commitment to allowing innovation both in the Medicaid system and in the individual group market and small group market at the state level, and we're glad to see some innovations already coming forth. You read about them every day. This morning we read about Iowa bringing forth some really novel ideas about how they can innovate in that state and make certain their citizens have coverage. Along with CMS, we released a state innovation checklist to help states accelerate their plans to alleviate burdens caused by the current law and to fast track those changes. There are a whole lot more plans and changes that we have in the offing, and we're working on them, and as you know, every single day. If you have any interest in looking at them, you can go to hhs.gov/relief, hhs.gov/relief, and you'll see more of the actions that we have taken to protect patients. We view these administrative actions as a key piece of work that we do here at HHS to improve the health and the well-being of the American people. But we can't do this job alone here from the Humphrey Building. As you know, I like to talk about our job, our roles being focused on patients and people and partnerships. And the partnership that we have with this administration working toward health reform is so incredibly encouraging. A big part of that is the leadership and expertise brought to the table by the Vice President of the United States. I used to say that this gentleman had a heart as big as the entire state of Indiana. But now I'm proud to say he's got a heart as big as the entire country. Won't you please join me in giving a large, huge HHS warm welcome to the Vice President of the United States, Mike Pence.
Thank you, Secretary Price. Thank you for those gracious words and insights, and especially just thank you for your service to this administration and your lifelong dedication to patient-centered health care. As a physician, as a public official, you've literally dedicated your life to the health and well-being of the American people. And Secretary Tom Price, we are grateful for your service. Thank you. You mentioned my Indiana roots, so you'll not be terribly surprised to know that I'm also grateful to be joined today by a fellow Hoosier who literally has brought a lifetime of experience in healthcare policy to her new role as administrator of the Center for Medicare and Medicaid Services. So would you join me in thanking Seema Verma for her character and her vision and her professionalism. Thank you, Seema. Yeah, I'm really honored to be here today at the United States Department of Health and Human Services. I bring greetings from the 45th President of the United States of America, President Donald Trump. I really came here today to do two things: to express the President's appreciation for the work that each one of you do here at Health and Human Services, and of course to address one of the most pressing issues facing the American people today, the ongoing collapse of the Affordable Care Act. But first, a word of gratitude for all the dedicated men and women of the Department of Health and Human Services. And day in and day out, the public servants in this room and all across the country improve the health, safety, and well-being of America. It's not an overstatement in the least. And the President and I are truly grateful for your service and your dedication. Under this roof and in these halls, the men and women of HHS have spent more than 60 years working on behalf of the well-being of the American people. Today, the Department of Health and Human Services employs 80,000 people and runs more than 100 programs and projects that impact American communities and American lives every single day. Through the Food and Drug Administration, you make sure that the food we eat and the medicine we take is safe and effective. Through the Centers for Disease Control, you protect the American people from the threat of epidemic. You help families get on their feet through the Temporary Assistance for Needy Families program. And of course, you help tens of millions of seniors and vulnerable Americans get the health care they need through Medicare and Medicaid. The truth is that your work changes lives and improves lives every day. You know, there's an old saying that when everybody in your family is healthy, you have lots of problems. But when one person in your family isn't healthy, you've got one problem. The reality is you focus on that which is most important to the American people, the health and well-being of their loved ones. You are, in a very real sense, the hands and feet of a caring nation, committed to the health and well-being of our people. And make no mistake about it, and never doubt it, the Department of Health and Human Services and all you dedicated employees make a difference in the lives of Americans every single day. Would you just give yourselves a round of applause, because you deserve it, and all those that are looking on. So I'm here to say thanks, but also to address the ongoing collapse of the Affordable Care Act, or as the President says more clearly, literally the death spiral of Obamacare. You know, I can promise you this president is fighting every single day to rescue the American people from this policy, to repeal and replace Obamacare and give the American people access to the world-class health care that every American deserves. Now, I know this room is filled with men and women who care deeply about bringing high-quality health care to every American. And rest assured, President Donald Trump wants exactly the same thing. The president's vision for health care is really pretty straightforward. We want a dynamic national health insurance marketplace that lowers costs, increases quality, and gives more choices to working families. We want American businesses to have the freedom to give their employees the affordable coverage that they need and deserve. We want to give states the freedom and flexibility to create the healthcare system that works best for them, for their most vulnerable. And most of all, we want to empower the American people to make healthcare choices that are best for them in a free and open process. In short, under President Donald Trump, we seek a brighter healthcare future for every American. This will be the North Star of our administration and for everyone who works on healthcare here at HHS. But make no mistake about it. To make this vision a reality, President Donald Trump is going to keep his promise to the American people, and working with this Congress, we're going to repeal and replace Obamacare. Now, we all remember all the broken promises of Obamacare. I was actually in the Congress when I heard them ushered forth on the floor of the House of Representatives. They told us if you liked your doctor, you could keep him. They told us if you liked your health plan, you could keep it. They said if Obamacare passed, that health insurance premiums would go down. You know, President Abraham Lincoln once said, give the people the facts and the republic will be saved. And thanks to the exceptional work here at HHS, the American people now have new, hard facts. And they know for a fact that Obamacare has failed. Last month, the professionals here at Health and Human Services issued a study showing how Obamacare has actually led to skyrocketing premiums across this country. This report found that premiums have more than doubled since Obamacare went into effect. Whether it's Nevada, North Dakota, or Ohio, every state has seen premiums spike under this failed law. In Louisiana, they're up 123%. In Tennessee, they're up by more than 175%. In Alaska, Alabama, Oklahoma, tens of thousands of people are paying 3 times more for their plan under Obamacare. Remember, the last administration promised that Obamacare would lower premiums on the individual market by up to $2,500 for American families? The reality? Premiums have actually increased by nearly $3,000 on working families across this country. At this moment, millions of Americans are facing double-digit premium hikes heading into 2018. And while costs are soaring, even worse still, choices are plummeting. Insurance companies are pulling out of Obamacare left and right. Right now, a third of American counties, including 5 whole states, only have one choice of Obamacare insurance coverage, meaning they essentially have no choice at all. And as the map on the stage shows, using information HHS released just yesterday, tens of thousands of Americans or more won't have any insurance options at all next year. In the past few weeks, the last health insurers have announced exits from at least 23 Obamacare markets. Take a look at Ohio, where the last statewide insurer announced 2 weeks ago that they're likely to leave Obamacare. The red squares on the map are counties without any coverage. More than 13,000 citizens in Ohio will be affected with this no-choice option. Now look at Missouri. Some 25 counties in the Show Me state won't have any insurance available under Obamacare. And if you look just north in Iowa, you'll see that nearly the entire state has only one insurer. And if that company pulls out, which it has said it might well do, then 94 of 99 counties in Iowa will be completely without coverage under Obamacare. And remember, many insurers are still deciding whether to pull out under Obamacare exchanges. If and when they do, hundreds of thousands or even millions more Americans could have no health insurance options this time next year. With premiums more than doubling for the average American, with deductibles so high that most Americans can't afford to use their Obamacare coverage, it's no surprise that Obamacare itself has woefully fallen short of its goal to cover the American people, as the other chart on the stage shows. Back when Obamacare was first passed, just over 7 years ago, the Congressional Budget Office estimated that 23 million Americans would be covered by now. That's the blue line on the far left. It quickly became apparent that this was far-fetched, to put it mildly. Last October, the Obama administration estimated that 14 million Americans would be covered by now. That's the next line. Yet as HHS released just yesterday, and as the red bar shows, in reality it's even lower. As of March of this year, while 12.2 million selected a plan, only 10.3 million Americans actually paid for their premiums. That's less than half the number that was predicted under Obamacare. And nearly 2 million Americans dropped out in the same year, not paying the premiums that they had signed up to pay for. As the president said just moments ago, 2 million more people just dropped out of Obamacare. It is a death spiral. And as CMS explained in the same report yesterday, in their words, high costs and a lack of affordability were the most common factors individuals cited when asked why they didn't keep their coverage. The Affordable Care Act is failing, and American families and businesses are paying the price. You see, it's not just about the statistics, although policymakers in Washington, D.C. always have to look at the big picture. But you here at HHS know this is about real people. This is about American families. This is about a burden that's being placed on the American people, one American at a time. I've seen it firsthand as I've traveled around this country. I've heard it from small business owners in roundtables where we've gathered and heard about the weight of Obamacare's taxes and mandates on their business that have caused some of them to speak with tears in their eyes about their decision to discontinue health insurance coverage for their cherished employees of many years. And I've heard it from individuals like Julie Champagne just this past Saturday in Wisconsin. You know, I met Julie on a trip to Milwaukee, and she's a great lady, has a great family. She and her husband have been working their hearts out in their small business for many years. But Julie confided in me that she's got some pretty serious health issues, and health insurance is just vitally important to her. Now, Julie's been buying her insurance on the individual market since 2004. She told me she wanted to believe it when President Obama said that she'd be able to keep her plan and keep her doctor. But it turned out it just wasn't true. Julie lost her health plan. Then she lost her doctor. And ever since, she's been forced to buy unaffordable and unusable health insurance on the Obamacare exchange. In 2016 alone, Julie told me that the Obamacare plan for her family cost more than $9,000 in premiums, with a deductible of $13,000. And late last year, she found out her premiums were going to go up by another $2,600 this year. At this very moment, Julie told me that her Obamacare health insurance plan costs more than her mortgage, and she can't even afford to use it because of the high deductible. In fact, she told me with genuine emotion in her voice that a few months back she actually made the decision to go without health insurance for several months just so she could afford Christmas presents for her kids and her grandkids. Real cost of Obamacare on the American people. It's just wrong. But that's the choice too many Americans are forced to make under this unaffordable Affordable Care Act. Julia basically said to me for the longest time, she just felt like we have no hope. But I looked her in the eye, and I told her, Julie, help is on the way. And I promise you it is. The simple truth is President Trump is right. Obamacare is collapsing. And frankly, you'd have to be blinded by partisanship to believe otherwise. And unfortunately, a lot of people in this town are, like most of the Democrats in the Congress, for instance. The American people deserve to know that the ones who gave us Obamacare now won't even lift a finger to help us clean up the mess that they've created. And their willing allies in the media continue to try and lay the blame for Obamacare's failures on this president, this administration, as we try to rescue the American people from its failings. But fortunately, thanks to the efforts of Speaker Paul Ryan, on May 4th, the House of Representatives passed the American Health Care Act, legislation that will repeal the taxes and penalties of Obamacare, expand health savings accounts, and give states historic flexibility to reform Medicaid in ways that will best serve the most vulnerable in their communities. And as we speak, the American people should be encouraged to know that under the leadership of Senate Majority Leader Mitch McConnell and hardworking members of the U.S. Senate majority, the Senate is, as we speak, working tirelessly to improve this legislation and create an orderly framework to transition our healthcare economy away from the regulations and mandates and taxes of Obamacare to a patient-centered healthcare system built on personal responsibility, free market competition, and state-based reform. In fact, the President and I will be welcoming key members of the United States Senate to the White House at lunch today to continue discussions on how we can move forward to repeal and replace Obamacare and rescue the American people from the ongoing collapse of this failed policy. You know, for the past 7 years under Obamacare, we've had a healthcare system based on the misguided premise that the federal government should order every American to buy health insurance, whether they want it or need it or not. That politicians know better than patients and doctors, and that worst of all, that the American people cannot be trusted to run their own lives and make their own health care choices. President Trump is fighting every day to restore basic freedom to America's health insurance system. And the men and women of Health and Human Services are essential to this effort. Each of you in this room and the some 80,000 employees of Health and Human Services, I know are men and women who've answered the call to public service because you care deeply about the health and well-being of the American people. Well, I'm here to say thank you for answering that call. And just know, as we move forward, as we give the American people more choices for more affordable health care, we give states freedom and flexibility to meet the needs of our most vulnerable, know that you, the dedicated men and women of the Department of Health and Services, will continue to play a leading role in making the best health care system in the world even better. So thank you for your service to the American people. God bless each of you. God bless all our health care providers. And God bless the United States of America.